Hello, everyone. Dr. Hess here. Thank you for joining us. We have reached the end of our textbook. This is the last lecture of our textbook on chapter 15. We're going to be talking about kind of the legal and ethical problems and issues in abnormal psychology. Thank you for joining us. So in today's lecture, we're going to be talking about some of the goals related to the science and practice of psychology, some of the issues around deinstitutionalization of America, and some criminal and civil commitment, a little bit of forensic psychology. For you, our text will be defining kind of privacy, confidentiality, and privilege when it comes to psychology and counseling. So let's quickly define what ethics are. Basically, ethics in psychology are the accepted values that provide guidance to make sound moral judgments for clinicians, doctors, psychiatrists, counselors, social workers, marriage and family therapists. These are all developed by kind of professional groups or organizations. And in order to be licensed, usually you have to abide by these ethical codes of ethics that the different organizations have. The goals for ethics in psychology and science of psychology is that we want to have benefit or do no harm to our patients. We want to make sure that we are building and establishing trust with them. We want to have integrity, promoting honesty and trust. We want to make sure that there's fairness and equality in our ability to provide treatments and in research. And we want to respect people's rights and dignity, their privacy and confidentiality, and the fact that they have their own self-determination. The deinstitutionalization of America is the release of inpatients in hospitals and community settings. This reached a peak at about 1955 when we had almost 560,000 beds in state hospitals. Right now, we only have about 60,000 in 2005, and in 2010 there's about 43, and we probably are still going down in this thing. Because most of the people that were in these institutional mental hospitals were now housed in state and federal prisons. There's lots of negative effects in the fact that we were defunded these mental hospitals. A lot of people that were now ended up being homeless. Or in prison, as we talked about before, which is not really the best treatment for any kind of psychological disorders. So when we're talking about civil commitment or the committing someone to mental hospital, that's a state-initiated procedure that forces a person to go and be under the observation in a mental hospital because they are deemed to be a danger to self or to others. The court can also commit to a person to outpatient treatment, in other words, ordering as part of their sentencing that they receive counseling as part of this thing. And also on discharge of hospital, they can also say you need to also have outpatient treatment. There are a lot of people who are criminally committed to kind of a prison / mental hospital. These people are there because they've been found under their trial for their crime to be not guilty by reason of insanity, or guilty but mentally ill, or incompetent to stand trial. And so they will be in here until they can stand trial. If you've been incompetent to stand trial, you receive treatment until you are deemed healthy enough to help with your own defense in the court. There's some rights that people who are committed to mental hospital have. They have the right to refuse treatment um, that they have. They don't have the right to be let out of the hospital unless if they've been committed, but they do have the right to refuse treatment um, for their disorder. So let's talk a little bit about privacy. Privacy is basically the limitations that access of other people to one's body and mind, including one's thoughts, beliefs, and fantasies. This is what we consider to be when we keep something private to ourselves. Confidentiality is agreement that private information revealed during therapy will not be discussed with others. There are some limits of confidentiality, such as if you are harm to self or other, oftentimes the counselor or doctor will have to inform someone so that you don't hurt other people, such as the local police, or if you're harm to self, you can have initiate a 5150 or a commitment to mental hospital to have them be in a safe place while they're under crisis. Privilege in the field of abnormal psychology, or just psychology in general, is a legal term that prevents a therapist from revealing confidential information during a trial proceedings. Of course, a judge can order a counselor to do this, but the counselor or doctor will exert their privilege as a legal way of slowing down and not breaching the confidentiality between the doctor and the client or patient. The Health Insurance Portability and Accountability Act, also known as HIPAA, has a lot of protections for those of us who are using healthcare, as far as restricting information, only be used for insurance billing and for our treatment. In other words, we don't want any information to get in the hands of people that don't really need it. Most therapists have a duty to warn. In other words, it's a therapist's duty to use reasonable care to protect third parties from dangers posed by patients. So if someone comes to you and you're their counselor and they tell you, I'm going to go home and kill my wife, you have a duty to warn his wife that she is in danger, and you should also contact the local police to let them know that this is a possible criminal act or harm to another, or murder. Most psychologists, psychiatrists, well, let me say, all psychologists, psychiatrists, marriage and family therapists, social workers, licensed counselors are all licensed. They have gone through graduate school to some level and have done an internship under a licensed clinician in their particular field, and then have passed a written and usually an oral exam, and in order to be licensed, and then have continuing education as long as they're licensed, somewhere between 36 and 40 hours every 2 years of continuing education to keep up with the most recent research and treatment. Each state has their own licensing board for this. So Oregon would be different board than California. That would be different from New York. There is a law and state law and code of ethics that goes along with each licensing. All psychologists and counselors are subject to malpractice, where they have maybe been practicing outside the scope of their skills or their training. and they can be sued by their patients if their patients are harmed by their lack of skill. So psychiatrists are usually known as the medicine men and women of the field of abnormal psychology. They are the most, since they are medical doctors and gone to medical school, are the ones that usually have hospital privileges and also the right to write prescriptions for psychotropic medications. Some psychologists in some states and in the military can write some prescriptions for people, but that's very rare. Mostly it's the doctors that are doing that. And of course, counselors, social workers can't write prescription for medications at all. They have to refer to a doctor to do that. And we've come to the end of our chapter and the end of our textbook lectures. We made it. I'm so glad that you're able to help skim these quickly with a quick little um, lecture from me. I appreciate, I really do, I really appreciate the work that you put into the class this term. Keep finishing strong. We still have a little bit of work to do, and I again appreciate you all being here, and I will see you in the discussion boards. Bye for now.